already been arrested in connection with the seizure. Another bid to export a consignment of 180 canisters of laughing gas to South Africa by a freight agent, Oyekola Benga Akin, for a fee of 2 million naira was also frustrated by operatives who seized the cargo and arrested the suspect. Meanwhile, NDLEA operatives on Friday 25th August succeeded in arresting a drug kingpin, Ngene Emmanuel Onyedikachi, who recruited the fake couple Ilonze Kingsley Onyebuchi and Ilonze Roslyn Nonyelum, arrested for ingesting 1.822 kilograms and 1.50 kilograms of cocaine respectively at the Lagos airport on 1st August while on their way to India. The kingpin was picked at his residence located at 28 Afolabi Brown Street, Akoka, Yaba, after an intensive surveillance that lasted 25 days. During his interview, Onyedikachi confessed that the two suspects, Ilonze Kingsley Onyebuchi and Ilonze Roslyn Nonyelum, were introduced to him by another member of his syndicate, who he claimed he met at Zion Church in Sele area of Lagos. He explained that the drug was sourced from Guinea-Conakry. The suspect revealed that when he got information about the arrest of the fake couple, he threw away his mobile phone along with the SIM cards to avoid being traced, adding that he became relaxed and refused to leave his house because the two couriers do not know his house, since they have only met twice at different locations. He said he was living in India before he returned to Nigeria in 2022, after the Indian authorities discovered that he was using an Ivory Coast international passport. A blue Acura Legend car was part of the items recovered from his home during his arrest. While operatives of the Lagos State Command of the agency on Monday 28 August arrested a suspect, Peter Iwebema, at Ikorodu with 79.5 bags of cannabis sativa, weighing 864.5 kilograms. Their counterparts at Tinkan Port Command intercepted 27 parcels of Colorado, weighing 13.5 kilograms. The seizure was made from a container MSMU 5664550 coming from Toronto via Montreal, Canada, during a joint examination with men of customs service. The synthetic substance was discovered concealed in a bag hidden in a Ford Edge SUV, which was part of 3 units of used vehicles and motor parts in the container. In Sokoto, operatives on Tuesday 29 August arrested 2 male suspects, Nafiu Azika, 30, and Jamilu Aminu, 35, with 330 kilograms skunk, while another suspect, Ismaila Razak, 38, was nabbed with 34.5 kilograms of same substance and 9.5 grams of methamphetamine on Saturday, 2nd September, at Olodo area of Ibadan, the Oyo State capital. Across the state and the Federal Capital Territory, Abuja, NDLEA commands intensified the agency's war against drug abuse wider advocacy campaigns to schools, worship places, palaces, and local communities, among others. For instance, the sensitization lectures were conducted at Holy Trinity Gospel Church, Ogbomoso, and for Muslim faithful at Jamato Narsiro Islam Mosque, Ilorin. Members of the Association of Hairstylists in Ado-Ekiti, leaders of Road Transport Union in Abeokuta, traders at Quarter Market, Oka, pregnant women at Primary Healthcare Center, Boni, Dekara District Palace, Babana Community in Bogu Local Government Area, and at Nuru Huda Islamia School, Kafin Mayaki. While commending the officers and men of the agency across the commands for their efforts in drug supply reduction and drug demand reduction activities, the Chairman Chief Executive of NDLEA, Brigadier General Mohammed Buba Marwa, retired, charged them to remain steadfast. That's it on arrests and seizures. Now, here are the wider activities across the country for the week. On Tuesday, August 29, 2023, the Ekiti State Command of NDLEA lectured members of the Association of Hairstylists in Ado-Ekiti on the dangers of drug abuse to their health and business. The agency identified risk factors associated with drug abuse and the need to support skilled workers in making informed decisions about drug use. The Niger State Command also delivered a wider sensitization lecture on the same day at Dekara District Palace, Babana Community in Borgu Local Government Area. The lecture highlighted the treatment options available by the NDLEA for drug-dependent persons and the necessity of eradicating stigma against drug users in the community. On Wednesday, 30th August, the Kano State Command took the wider sensitization lecture to Nuru Huda Islamia School, Kafin Mayaki. The agency encouraged learners to remain faithful to their religious convictions and resist the urge to experiment with drugs. On Thursday, the 31st of August, the Ogun State Command facilitated a wider sensitization lecture for the leaders of the Road Transport Union in Abeokuta. The agency urged the union to support the NDLEA in its efforts to keep the roads free of drug users and peddlers for the safety of motorists. On Friday, September 1st, the Oyo State Command of NDLEA delivered a wider sensitization lecture at Holy Trinity Gospel Church, Obomosho, while on the same day, the Kwara State Command also delivered a similar lecture for Muslim faithful at Jamaatul Nasrul Islam Mosque, Ilorin. The agency continually recommends the inclusion of drug education in religious teachings to promote abstinence from drug use. Still on Friday, the Anambra State Command of NDLEA organized a wider advocacy lecture for traders at Kwata Market, Oka. This is part of the agency's efforts to ensure that all members of the society are aware of the dangers of the drug scourge and their role in fighting the menace. Equally, the Rivers State Command on Friday, 1st September, lectured expectant mothers visiting the Primary Health Care Center, Boni, for antenatal care. The agency underscored the risks associated with drug use during pregnancy and the necessity of continuing to abstain from drugs even after childbirth. Concluding the wider activities for the week was an advocacy visit paid to the acting chairman of the State Local Government Service Commission, Honorable Terka Mamo, by the Benue State Command. The agency encourages leaders to utilize their positions to spread the message about drug abuse and prevention. That's the update for this week. My name is Blessing, and I hand you over to our host, Mr. Femi Baba Femi.
Thank you very much, dear Blessing, and welcome back from the news highlight segments. Let's quickly remind ourselves about some of the rules guiding our process of engagement on this program today. As usual, when after the presentation by our speaker, and we approve those already asking for the mic to be on the speaker's corner, please let's ensure that we remain muted until after our guest is done. That's when we'll start asking people to unmute themselves and ask their questions or interrogate her presentations, and thereafter we'll take it up from there. And we encourage us to please make our contributions, our questions in few seconds. We don't also encourage unauthorized interruption. We don't discuss politics here. Let's limit ourselves strictly to the subject of conversation today. And that's how we're going to do it today. So let's all remain guided so that we can all enjoy and benefit from the conversation today. Thank you once again for your usual cooperation. Today's program, as usual, again, will be as interactive as possible. So we want to respond to all your questions and listen to your contributions on today's subject of discussion. Please stay calm and let's enjoy the conversation on today's subject of discussion. This is part of our engagement, a part of our commitment to engage with all our stakeholders in all that we do. But quickly, before I introduce our guest today, let me quickly remind us again about the NDLA call center. That's a call center that the agency opened since last year, where we have a number of professionals, mental health experts, psychologists, psychotherapists, clinical psychologists, counselors, as well as psychiatric doctors. All of these people work 24/7 at the call center, and basically all they do is to take your calls, especially those that are struggling with substance abuse, their family members or friends, to assess the situation and provide needed and necessary help to you. So please feel free wherever you are in any part of Nigeria, either northeast, northwest, north central, southeast, southwest, south, any part of the country, wherever you may be. The number you call, the number again is a 12-digit number. It's not like your regular 11-digit number. It's a 12-digit number because it's a special So don't let us forget that it's a 12-digit number. Don't remove anything from me thinking that it's supposed to be 11 digits. So the number to call is 0800 10203040. I call it again 0800 10203040 is a toll-free helpline, so you don't need to have credit before you call the line. We bear the cost of your call and conversation from this end. That's all part of what we do to encourage those who, for fear of stigmatization, are not ready to go into a rehab center. And so we provided this call center for you to interact with experts so that they can provide you the needed help, especially those whose cases can be addressed through teletherapy, and those that may have to be checked in when your situation is assessed by our experts at this center. Then if you need to be checked in, they will also guide you and direct you to the nearest rehab center close to you, follow up with your treatment, and also check up with you on post-treatment rehab, reintegration. That's about that. Again, we also like to tell you that the center is language friendly, meaning that if you can't speak English or you can't speak Pidgin, they can also address you on some specific days of the week. They can also talk to you in Hausa, Yoruba, and Igbo, meaning that language is not a barrier for you. So that's about the NDLA call center. Now let me formally introduce our guest today. She is Oluwatoyin Ogunkami. I guess I got that right. Ms. Oluwatoyin Ogunkami is a foremost family psychologist who works with families and individuals to address and resolve various psychological and emotional issues within the family unit. She has parents to understand and connect with their children, and also works with adolescents in maintaining great mental health by providing them with tools and resources to live a thriving life. She is the founder of Parenting Support System Limited, an organization that has trained over 5,000 parents in becoming deliberate in their roles as parents. She is the convener of the Smart Parenting Community Outreach, a not-for-profit organization that trains and provides parents in less privileged areas with tools and resources to be effective as parents. Oluwatoyin, with her husband Taiwo, is the founder of Blinking Youth Development Academy, a platform that guides adolescents and young adults in becoming independent, well-balanced, and productive members of the society. As a best-selling author, Oluwatoyin has published 4 books and has written several e-books. She currently works in a mental health facility where she works with individuals struggling with battling with substance use disorder and mental illness. If it's possible, I would have just said that we should jam our hands together as I, at this point, invite our guest speaker, Ms. Oluwatoyin Ogunkami, to please unmute herself. And for the next 30-40 minutes, we will sit back and listen to her presentation. Thereafter, we would be interrogating her presentation and then making contributions. Thank you, Ms. Oluwatoyin. Please go ahead and unmute yourself.
Okay, thank you so much, sir. Good evening, everyone. Thank you for having me here to speak with the audience on your platform. So today I'm speaking on stigma, the role of parents, family, and friends in getting help for mental disorder patients and substance use patients. First thing I'll look at is the fact that this conversation is one conversation we need to keep having, because the more we talk about mental health, the more we talk about mental disorder, the more we talk about substance use disorder, the more people will be educated about this disorder, and the better informed they will be to make the right decisions when it comes to treatment and recovery. A lot of people do not understand what it means to be battling with mental illness or what it means to be battling with substance use disorder. And that's why you hear people saying, can't they just snap out of it? What is there? Why are they feeling sad with all the things they have? You know? And you hear a whole lot of remarks disorder. The lady was suffering from postpartum depression, and the men that brought her here to the facility, they were quite hostile and aggressive towards her. They were pushing her, shoving her, saying that she was stubborn. And this is due to the fact that they did not understand what it meant to be mentally ill. And it's so unfortunate that people battling with mental illness or substance use disorder are often stigmatized. Not just stigmatized by the general public, they are often stigmatized by even their family, their friends, or even their parents. They call them, they're being lazy, they're useless, all sorts of negative labeling is used on them. And one thing we need to know when it comes to mental illness, just like any other illness, is that the people battling with these things, they don't ask for it. So, for example, you see someone battling with cancer, or you see someone battling with heart disease. Do we go around stigmatizing them, saying that they caused it on themselves? No, we don't do this. And it's the same with mental illness. When we talk of mental illness, what really is mental illness? Mental illness is a state whereby the person or the individual is not able to cope with stress. The person is not able to cope with daily stress. The person is not able to deal with the stress of daily living. The person cannot function, cannot learn, cannot work appropriately. The person has so many things going against him or her. And because of those things going against him or her, the person cannot do his daily activities. This person's daily activity is being, the ability to function properly is being affected. And if someone has mental illness, it's not, it's not like the person has put it on himself or herself. These are things that was genetics or caused by the stress of daily living. And thinking of our country, Nigeria, it's stressful living in Nigeria as a whole. So when we talk of mental illness, there are different forms of mental illness. I'll just mention a few. We have mental illness like depression, where this is a mood disorder that is characterized by type of disorder. Anxiety disorder is a condition that is characterized with excessive worry and fear. We have bipolar disorder. This is another mood disorder that is characterized with alternate period of sadness or depression and mania. So at one point the person is excessively happy, another point the person is excessively sad. We also have schizophrenia. This is a severe mental disorder that is characterized by disorganized thinking, hallucination, and delusion. We also have post-traumatic stress disorder. This is developed due to the fact that a person has been exposed to a traumatic event and is having constant flashbacks, nightmare, and severe anxiety due to that particular event. We also have eating disorder, we have attention deficit disorder, we have personality disorders. All these are mental illnesses that are complex, and the cause of this mental illness is either due to genetics, environmental factor, the brain chemistry, or life experiences. So when individuals have mental illness, please, it's advisable that we seek help for them. We do not stigmatize them. So when we're talking about stigmatization, what do I mean by stigmatization? Stigmatization basically is when you have a negative, when you have a negative, when you look at somebody negatively due to the fact that the person due to the fact of what the person is going through. So, for example, we look at the person negatively because of a particular attribute. So, some people could be stigmatized because of their color, their cultural background, or disability, or mental health, like what we're talking about. And when we talk about stigmatization, it's when we look at the person as being worthless or as not being good enough. And people battling with mental illness should not be stigmatized. Each time we look at them as being not good enough, it prevents them from seeking help. Each time we label them, each time we isolate them socially, it makes them not want to come out and say they have a problem. And that's why cases of depression, we have people who have depression and they will not want to talk to people because they feel people will say they are weak. How can you have depression? You that you have everything, every God has given you everything. For some people that stigmatize, for people that stigmatize people, patients battling with mental illness, some use religion to stigmatize them. Oh, you call yourself a pastor and you say you have depression. You call yourself an imam. You say you have anxiety attack. This has nothing to do with spirituality. Although there's a thin line between mental illness and spirituality, that's another topic for another day. But most cases of mental illness has nothing to do with the person's religion. It has to do with the fact that the person cannot cope with the stress of daily living. And when someone cannot cope, the person tends to have some of this mental illness. And that's why it's very important as family members, as friends, to keep checking up on each other because you don't know who is battling with mental illness. Now, what can we do? What's the role of the family? What's your role as a parent? What's your role as a friend? What's your role as a family member in getting help for people around you battling with mental illness or substance use disorder? One thing we need to know is that our role in getting help for these people is very crucial and has a significant impact on the recovery process. Over the years, working as a family psychologist and working as a substance abuse therapist, I've seen patients who, due to the fact that their family members supported their treatment, they were able to get help. They were able to get help on time. They were able to recover faster. This is due to the support of the family members. Now, I've also seen cases whereby the family members did not support them in any way. And because the only thing the family members were doing were just labeling, saying all sorts of negative things about the person did not want to come for help. And even when the person came for help, the person felt, oh, I'm a burden to my parents, I'm a burden to my friends. Each time we label people battling with mental illness, we're not helping them. And their recovery process, their treatment period tends to linger on. But for people who have the full support, the full support, emotional support, physical support, financial support of family members, their recovery journey is faster. So, what can we do? How can we help? So, I'll be talking about things we can do to help our family members when we know that, or when we see that they have a problem or they have a challenge. First thing is, as parents, I'll talk to parents first because we are the ones God has given these children to us as that we're the number one caregiver, we're the number one teachers. As parents, most times parents are the ones who identify that there's a problem with their children. So the first step or your first role in helping them get some help is to identify that there's a problem. when you see, so parents or siblings are most times the first people or the first person to know that there's a problem, because you would have noticed that there's a change in the way this person is behaving. There's a change in his physical health. Maybe the person is no longer taking care of himself. Hygiene, there's a lack in hygiene. Social interaction, this person is no longer going out with his normal friends or her normal friends, or the person is isolating himself in the house or in the room. So most times it's the parents or the siblings that tend to notice this change or these changes in the person. So the first thing we need to do as parents is to be able to identify and recognize the differences in our words, in our children. If you are able to identify these differences, then it's easier for you to help or to intervene. The next is you need to get help for the person. You need to speak with the person. Is your role to get help for the person is not to morally make the person down. Yes, the person is battling with substance use disorder. The next step is for you to help the person get intervention. It's not you castigating the person. It's not you. The person is already down. That's what they meant for those battling with substance use disorder. The person is already down. The person is already fighting a battle. So at that point in time, is your emotional help, your physical help that the person needs. So your role is to help the person, encourage the person to go for treatment. And one of the things we advise voluntary admission into either a rehabilitation center or a wellness center. Well, like the place I work, we encourage voluntary admission, because when the patient comes in voluntarily, it helps the treatment and it helps the recovery process. However, with the support of the family, this process is even faster and easier. So the first step, like I said, is identifying that there's a problem, recognizing that there's a problem. The second step is getting help. Offer your emotional support and understanding to the child or to the person, to the either a child or your friend or your family member that is battling with this illness. The third thing you need is to get yourself educated. So once there's been a diagnosis, the person has gone in to the center, there's been an initial assessment done, and the person has been diagnosed with either a mental illness or substance use disorder, please, you need to get yourself educated. Because one of the things we notice is that when people are battling with mental illnesses or when people are battling with substance use disorder, it's not just that person's problem, it's everyone's problem. Everyone in the family is affected by it. So it's important you get yourself educated to know what you can do to help this person get better. Because after admission, when the person comes home, there are a lot of things you will need to do to support this person in the treatment and also on the recovery journey. We need to encourage them to get treatment. I've spoken about that. That voluntary admission is very important. We also need to create a supportive home environment. We need to create a supportive home environment for the person. So the person is coming back home. That's not the time you now start, being very negative towards the person. The person needs your support. The healing process, the recovery process, the person needs your support. So you need to support the person emotionally, mentally, and physically. And not just this, even as you're supporting the person mentally and emotionally, you yourself, you also need emotional and you as a person, you need emotional and mental support as a parent or as a friend or as a sibling, because it can be very draining. Like I said, when one family member is battling with either use disorder, it affects the whole family. So therapy or getting treatment, the family members or the friends also need therapy, because each time you're helping your friend or your child emotionally, for some parents, they tend to see themselves as failure. Or I am, how did I fail this child? What did I do wrong? You know, and they tend to put that stigma on themselves. So even you as the parent, your role, child gets support, and your is to avoid blaming yourself. You don't need to blame yourself. You need to get emotional support too. Then one thing when I talk to parents, one of the things I tell parents is that as a parent, you need to teach your children healthy coping strategies. As mental illness, we need to do a lot of psychoeducation. Let our children know that it might be your first drag that will land you into the rehab center for mental illness. That's one of the things we tell our the youth. So for the youth we teach, for the youth we coach. Those are one of the things we tell them, that it might be your first drag that might activate mental illness. Because I've seen patients who, due to the fact that they were taking these substances, the substances they were taking activated mental illness in them. So it's important to note that mental illness is it's not the fault of the patient. Mental illness is something that could happen to anyone. And like I said, it could be either due to genetics, environmental factor, the brain chemistry being affected, or life experiences. Maybe the person was sacked from work, the person lost his job or her job, the person lost a spouse, the person lost a child. It could be anything that could trigger it. So that's why we need to teach our children how to cope, healthy coping mechanism when it comes to life stresses. So I'll be stopping here for now. Let me listen to questions, then I'll continue from them. Thank you so much.
All right, thank you very much there. Dear Miss Oluwatoyin Ogunkami, thank you for the brief and precise presentation there. I'm sure we have quite a number of people that would interrogate your presentation. But then first, I'm going to be picking at random now. This what I'm doing is not everyone on the space is well recognized, but then I just speak like we do every week. We just speak at random because we cannot recognize or mention everybody. So I will be just picking at random. For especially for those early comers on the space, let me recognize the Niger Diarist. I think he has a name, but he's right on the handle of the Niger Diarist. I think if he has to talk, he will mention his name again. All right, our regular Perpetua Namdi Emmanuel, thank you for being part of the conversation today. Thank you, Aminu. I have seen you, Aminu. I have seen Mohammed Bafo. I have also seen Dr. Uzo. Dr. Uzo is joining us from the UK. He's also a regular, and every week, Dr. Uzo has always made fantastic and awesome interventions on this platform. Thank you very much, Dr. Uzo, for finding time to join, to be part of this conversation today. Thank you, Ibrahim Yusuf of the Drug Free Area movement. I have seen you also on this space. We also have a very someone that had also been here before as a guest speaker, and that is Pastor Jeff Oluwagbemiga. Pastor Jeff Oluwagbemiga, thank you for being part of. Okay, sorry, I think I got muted at a point. But then I was trying to recognize Pastor Jeff Oluwagbemiga, who has also been a guest here before. Thank you very much for being part of. I'm sure somewhere you must know Mrs. Oluwatoyin Ogunkami because people, psychologists, people in your field, they know you as a very senior member of that clique. Thank you once again, Pastor Jeff. We also have some of our senior officers here. That is Para Bauer. Thank you, Commander Bauer. Thank you also, our own Dr. Jonah Kolo. Thank you for being part of the conversation today. Okay, now we are going to be moving to that segment of allowing people to interrogate the presentation by our guest today, and that is Mrs. Oluwatoyin Ogunkami. Okay, who will start? Who will take the first shot? What do I do? How do I decide who will take the first shot? Okay, Perpetua, let me give it to you. Perpetua, please go ahead. Let's take the first shot from you.
Okay, sir. Good afternoon, sir. Thank you so much for the opportunity once again. Thank you, Mrs. Oluwatoyin, for the excellent head talk about stigmatization. I just have a contribution to give. You talked about family being a support system to the victim, being the drug addict. Am I audible enough?
We can hear you loud and clear.
Okay, sir. Thank you. And I have one thing to say about family support and friends. And family and friends can also provide support by offering to accompany individual to appointments. You know, the healing process starts from the home. If the home, as you have said before, if the home is conducive, the patient can be able to heal both psychologically, both emotionally, both physically, and otherwise. And also, following them to appointments can still be a healing process for them, telling you that okay, you are not into this, you are not alone in this issue, that we are all into it and we are here to support you. And most especially, just that most addicts out there, you know, I have when someone saying that coke is an she's so addicted to coke. I said, wow, can coke be as an addiction? She said yes, that she cannot go one day without taking coke. And she's trying everything possible, that she has even gone to see a counselor for it. But it seems as if there's no solution to that she can only do anything without taking coke. And you know, coke has caffeine, and caffeine, you know, um, is also a thing that can make as in someone to be addicted to something and all that. And providing transportation, you can help in taking the patient to the hospital for appointments by providing your car, your money, your advice. Everything has to be involved, and also helping with daily tasks by showing that they are committed to helping their loved ones through the recovery process. So family and friends can help reduce the sense of isolation and shame that often accompanies mental health and addiction. Hello?
Please go ahead. I'll remove the person from speaker's corner.
Okay, sir. Okay, sir. Please, ma, can you talk more, or please give more insight on Coke, the normal Coke that everybody takes? Can it be a channel to addiction? And I just want to have a headway on that, so that I can be able to pass the information to that my friend that is addicted to Coke. Thank you so much, and thank you, sir, once again for the opportunity.
All right, thank you very much, Perpetua there, Mrs. Ogunkami.
Hello, sorry, I didn't get the last part of your question, please.
Okay,
Okay, Perpetua. Yeah.
Okay.
Go ahead, Perpetua.
My question is, can you give me, is there any solution to someone that is addicted to Coca-Cola that people takes? About my friend that is more addicted to Coke, that she cannot do a day without it, and she has gone to a counselor, a therapist for it, but it's as if that there's no headway, and she's still addicted to it. Thank you.
Okay, so thank you so much for the question. So part of this we're discussing is substance abuse disorder. Substance abuse is hard drugs. So I'm putting so not just hard drugs, basically. Substance could be anything you take compulsively. So addiction is anything you do compulsively and you cannot do without. That's what addiction is, basically. And like we said, addiction is a brain disorder and all that. So for the Coke, anything you do compulsively is addiction. So but yeah, could actually be an addiction. The person should see a counselor, and there are certain things they would work the person with. Work with the patient
okay.
and helping her to change. So it's just basically behavior modification, leaving that and picking up another habit, basically. But she needs to see a specialist. It's not something you can give recommendation or advice over the phone or over the network. It's something a person needs to do proper analysis to understand what's wrong with the person and all that. Thank you.
All right, thank you very much, Perpetua, for the question and the response from our guest speaker. Okay, I'm glad Dr. Uzo is already on the speaker's corner. Let's get the perspective of Dr. Uzo to this conversation. Dr. Uzo, if you are free, can you please unmute yourself and let's get your perspective to this conversation? Thank you.
Good afternoon, everyone. Thank you, Baba Femi. It's nice to be with you guys again. I'll try to go as quickly as I can because I'm actually in work as usual. Mrs. Ogunkoya, a very excellent presentation. Thank you. I hope I'm audible.
You're loud and clear, very loud and clear. Thank you.
Okay. Excellent presentation, Mrs. Ogunkami. Stigma, let me start with that and then I'll get to briefly address the question that Perpetua asked. Stigma is one of the biggest problems we have culturally as Nigerians. Even when we come out here, it still follows us. And when you were trying to explain stigma there, just again to add to what you've said, is complex of attitudes, beliefs, behavior, and structures that interact at different levels of the society. And one of the ways they manifest is, people get prejudicial, people get biased, people get discriminated against, just for the simple fact that they have mental health problem or they have substance misuse disorder. Sorry, somebody walked into my room, but okay. So these discriminatory prejudicial practices and policies can appear to endorse negative social norms and behavior and deepen stigma as well. So it's not something that easily go away, but it's something that can be managed. And having said that, there are factors. I'm not going to go on to a lot of theoretical basis, but there are factors that can influence stigma. things like blame culture, which we have 110%. We blame people. Oh, you're using colors. Oh, you're using tramadol. Oh, you're using that because your mate is doing very well, you're not. And then you have stereotypes of dangerousness. Oh, he's using colors. Don't go near him. He will harm you, or things like that. So you get people with stereotypes. Then you get unpredictability. But there are also positivities that can help to mitigate against these. Things like knowledge, awareness, education of mental health and substance misuse. And one of the biggest problems again is the media portrayal of the situation, the mental health disorder, the depression, the anxiety, the PTSD, the bipolar, the schizophrenia that Mrs. Ogunkobe has mentioned. You know, the way we see them, the way the media portrays them, they all add up into the stigma and the way people tend to deal with others with this problem. Uh, it also comes with consequences, which again, I'm not going to go into elaborate. She's talked a lot about it. But it's if we want to talk about stigma, it's going to take longer than just one session, but Femi, it's deep-rooted problem. And it affects both the people providing services, the people seeking for help, and even the families. And just to briefly address the question about someone drinking Coke, Coca-Cola, like you said, there has caffeine in it, and caffeine can be addictive. To give you perspective on that, a 33 ml, a can of Coke, you know, the can of Coke, 335 milligram Coke, has about 34 milligrams of caffeine in it. So depending on how much a day and how frequent, and then you begin to develop what Ogunkamide explained about increasing tolerance. You need more to get the same effect. And then you begin to develop that compulsion. You have to take them to be able to function. And then you begin to develop that dependence level where if you don't take them, you feel like something is missing. Again, this will be the basic pathway for someone to develop addiction. And what do we recommend? Mrs. Ogunkami has spoken about it. Talking to a professional, we'll do an assessment. We start with motivational. We hope and pray at some point there are behavioral modifications that would help. And I think I'm going to stop here not to take too much of your time, but if you need me to come in, just let me know. Thank you.
All right, thank you very much there, Dr. Uzo. Dr. Uzo is joining us even at work where he's based in the UK. Thank you for all that you do to make impact on this program every week. All right, let's get to the. Okay, Ms. Okugami, would you want to say anything to what Dr. Uzo has said, or we should flip? Can you hear me, Mrs. Ogunkami? I guess she's struggling with her network. Okay, let's go to the next. I'm sure with the contribution from Dr. Uzo there, Perpetua would have been doubly blessed. Her question would have been doubly answered already. Okay, let's get to the next. Okay, let's come to Ibrahim Yusuf, that's of the drug-free Arewa movement. Let's hear your intervention, contributions, or questions. Ibrahim, please go ahead. Ibrahim, can you hear me? Okay, if Ibrahim is
hello,
ready.
yeah.
Okay, go ahead.
Okay,
go ahead.
All right. Good afternoon, house, and then thank you, Mrs. Olua, for your presentation, and Dr. Oluwatoyi, and Dr. Uzo as well. I presently am working with a family, and what Dr. Uzo said was exactly what happened. The culture of blame. This young man, he's from a very wonderful home, and he happens to, within Abuja, one of the schools is a private university here in Abuja, and then he started taking some things. and he's having problem, mental issue. The father now was like, Ibrahim, I don't want to hear from you because he caused it for himself. What of his sister? She's in the US. What of his brother? He's there in NDA. What of this? He's there. What of his friend that they went to school together? He's there. But he chose to be in this condition. So let him die if he wants to die. Now I have to work with the father, work on the mother, work on the sister, work on the brother, work on their grandmother. The only support he has in the family is the grandmother. So I think is very, very important, as Dr. Ozo said, if we are to talk about stigma in this issue of withdrawal or help on the issue of mental health, is something that we need to do it maybe the next 6 weeks. We should be dissecting on the issue of stigma, because so many families, so many people are being pushed into this issue of mental health because they are being stigmatized within their families, especially when it happens that mistakenly you find yourself taking drugs. They can take care of you. Maybe some say that, okay, you go to school because of study, you become, you have issues, you have depression, family can easily help you. But when it comes to substance motivated mental issue, seriously, the stigma is so bad. And wherever, in fact, pastors can use you to preach in the church, imams can use you to preach or do sermons, and community, everybody will use you. Look at this person, is from a good home, but this is what he is. The reason why I'm saying this, though alhamdulillah, I'm okay, I'm fine, I live my good life now, but this thing happens to me like 20 years ago. I had the same issue where a father will look at me and say that, oh, I've disowned you. I don't want you to come to my family again. If I see you, I'll use bow and arrow and kill you or destroy you. You are no longer part of the family. And then moving out from the family, getting some people who will give me accommodation. So assuming I continue without somebody finding me and showing me love and help me out of that situation. Probably by now I could have been moving around with dread, dirty, picking trashes, or maybe I could have been dead. And I remember telling my dad before he died, this year, early this year, and I asked him a question. I said, Dad, what about assuming that I'm no longer in the family and then I'm a mad person? What will you achieve? They will still, people will be saying that, oh, the son of so person is a mad person. So the more I'm being stigmatized, you too, you'll be stigmatized, because there are places you go, people will tell you that you we are not able to take care of your children. So it's very, 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 very crucial. This young man needs help. We are working with his father, very reputable person in the society, but the father is still insisting that, look, he caused it for himself, so he should bear it. He cannot even take him to rehab center. He said that he cannot, but thank God the young man is having this remorse now. He's working, the mother now embrace him. His sister now works with him. They are trying to help him, and he's becoming a better person. So stigma is very, very big issue. And so many, sir, so many people today in Nigeria, so many people today are in the hiding. They are in the hiding because I don't know who I'll go and talk to, and he will use me as example. I don't know who I'm going to talk to. He will go and tell the other person, and the other person will go and tell the other person. And so many people are dying because they are afraid to talk to people. So this issue of stigma and the advocacy to see how we can be able to educate the society is very, very crucial. Thank you so much, sir, for giving me this opportunity.
Thank you very much for that live direct from someone who had experienced this, someone who is also helping others to come out of it. Thank you once again, our own Ibrahim Yusuf of the Drug Free Iowa movement. Miss Oluwatoyin, can you hear us now? Mrs. Ogunkami, can you hear us? I think, Francis, you may need to get in touch with her so that maybe she will need to exit and come back again. Okay, but then we continue with the conversation. Let's thank you once again, Ibrahim. Then let's take from Aminu now. Aminu, let's get your contribution. Can you unmute yourself and let's hear your contribution, please?
Thank you very much, sir. Good evening, everybody. I want to direct my question to Mrs. Oluwa Toyin, but she seems like she's not available. Anyway, I would like to talk about something.
If she's not available, we have Dr. Uzo. Dr. Uzo is on the line. If
okay,
please go ahead.
All right, thank you, sir. My question is, Mr. Oluwa Toyin talked about stress, which can also cause mental illness, and also she also talk about how the abuse of substance can also cause mental illness. That it's mostly not due to religious activity or anything. Okay, I just wanted to know. I'm just curious. I wanted to know. Okay, is there any difference? For example, like if is there one that's more severe between the one that's caused by stress and other environmental factors, and then the one that's caused by drug abuse, substance abuse, and also when it comes to their treatment, is there one which is has a high rate of that can be cured between the two? Like, is there any difference? And normally, I know the people that have mental illness due to other conditions, some of them never recover, but the ones that get theirs due to substance abuse, they do recover. But I want to know if that one too can be permanent. And also, I want to talk about the other thing is, I have a friend who is a medical doctor. He's a medical doctor, but he's into drug abuse. He normally he does pentazine. He used to inject himself. So he used to reach out to me for help. That he used to ask me if I can help him because he actually wants to stop. He wants to stop. So he asked me to be calling him. The anytime he feels the urge to go and do it, he smokes weed. He does, but the major one is that pentazine. That is it vaccine or injection. So, but the issue is, I advised him to go to rehab, but he said that I don't know that he might lose his medical license. So this happens like last year. We talk about this last year. So he's a medical doctor and he's into drug abuse. So I actually wanted to like direct him to NDLA, but he was like, okay, it's an issue for him that if he goes for that, he might lose his medical license because a doctor, there is no way he's a doctor and then he'll be into drug abuse. So I'm not sure if there is any way that he can be helped. Thank you very much. That's all I have to say. Thank you.
Thank you very much, Aminu. I think Dr. Uzo, this borders on your profession. Would you want to intervene here?
Yeah, sure. Thanks, Baba Femi. Thank you, Aminu, for the question. Am I audible?
Yeah, you are loud and clear, very loud and clear.
Okay, if I recall correctly, the first one you were asking about stress, mental illnesses caused by stress, like Mrs. Oluwatoyin was trying to explain, a mental illness is caused by drug use. Would that be correct?
Absolutely. And okay. What's the difference in treatment? That's one of the things.
Exactly. The difference is treatment. Yeah. The classification and definition of mental illnesses will be the same, but the causes may be different. For example, if you have depression, there are criteria for saying that someone has depression. You have low mood, you have apathy, you may have sleep disturbance, you may not be sleeping, you may be losing weight because you've lost appetite, you're not able to function, blah, blah, blah. So these are symptoms of, depending on the number of them you have, will mean you have depression.
Okay, I'm back. I actually was thrown out.
All right. And So now there are different things that can cause this. I'm only using this one as an isolated example so you can understand, you can get the picture. Yeah. So there are different causes that can lead to this situation where someone has developed full enough criteria to be say you have depression, you have anxiety, you have psychosis, you have schizophrenia. Drugs can do that. Genetics, for example, if you have parents who have schizophrenia, if the two parents have schizophrenia, you're likely also to have schizophrenia. Your chances of having that is about 40%. Now, going again, not to dwell too much on the theory, going on the treatment aspect, some like drug-induced psychosis, for example, responds very well to treatment antipsychotics. But what that is treating, it will be the schizophrenic symptoms which arose due to the drug use. The additional component of this treatment now will be to manage the drug use, which Dr. and Mrs. Oluwatoyin spoke about, the motivational, the rehabilitation, the continuing psychosocial support, which you will not need if someone, say, who has arisen from parents' genetic schizophrenia, where you're treating only the schizophrenia and then manage the consequences of that. Is that making any sense?
Absolutely, absolutely.
Yeah.
Let's move to the medical doctor now.
So the other one, the other bit, the medical doctor, yeah, I was coming to that. This is exactly what we're talking about today, the stigma. Did you get the picture of what you said? This doctor is worried that if he does get to that place, he will lose his license. That's incorrect. Every medical association do support their colleagues. That is exactly what we're talking about today, the stigma, the fear. In a nutshell, let me again just tell you, there are, to make it easier, types of stigma. You have the structural, you have the public, and you have the self-one. So when you look and break this down, you see it's deeply rooted problem. And for the doctor, what he's taking appears to be opioid-based medication, so he has opioid dependency. He needs to speak to a professional. He can come to my DM and we can have a chat about it, but he needs a professional. He needs also to speak to possibly a psychotherapist back there. And even if it means going to rehab, like Dr. Mrs. Oluwatoyin has spoken about, I will highly advise that. But there is help, and it's likely he's not going to lose his license. But he needs to, if he doesn't manage the problem, he will lose his license, he will lose his practice.
All right. Thank you very much, Dr. Uzode. Let me now come in. I think the fear expressed, that is not to say that that doctors should not go out and seek help, but then we have an example of someone who is actually a nurse working in a hospital, and she also got hooked on this pentazocine injection, and I think over time, I think she got hooked because of ectopic pregnancy. Ectopic pregnancy. And when she discovered that it's already gotten out of hand, she decided to report herself to her medical director to seek help so that they could help her. And guess what happened next? She was fired. And that took her now from the 100th floor to the ground zero. Her matter became worse. So sometimes when you hear stories like this, because of what we have seen, because of some experiences we have seen around us, we know indeed some of those. And that's why we're trying to encourage them not to allow this to discourage them. It's because Dr. Uzo mentioned something like, there are some people, even within the medical profession, who still, practice, who still engage in this stigmatization. So that's an issue there. That's a point there. I'm not sure, Mrs. Oluwato, you've not been, we lost touch with you because we were trying to call you in, even though you were.
I'm so sorry. I'm so sorry about that.
I know your network has been doing some zigzag since, but then.
So I'm back now.
Yeah. Are you able to catch up with any of the last set of questions?
No, I didn't get any of the questions, but I heard Dr. Huzo talking, and I got the drift that has to do with the doctor who is actually probably using and is afraid of stigmatization. That was the drift I got, but I didn't get the question exactly.
Okay, I actually okay. Let's move because okay. I think I don't know if you have a pen and paper there, so that let's quickly go to our DM before we come back to those on the space. We have some questions for you in our DM, so that because we may need to ask read some 2-3 questions together, so that you can answer them at a go.
Okay, so no problem here.
Okay, there is Soweto at Hub Suites. I have seen a situation where, in a bid not to be stigmatized an abuser, his brother started taking the substance to make him comfortable. I found it intolerable. What level of comfort can a parent or friend give that will not be too much? Wow. Do you get that? Ms. Oluwatoyin, do you get the drift? Do you get the question?
Please, can you repeat it again, sir?
Now, this person, that's Soweto,
yes,
is saying that I have seen a situation where, in a bid to not stigmatize an abuser, his brother started taking the substance to make him feel comfortable. I found it intolerable. Now his question is, what level of comfort can a parent or friend give that will not be too much? That's serious. Do you get that now?
Yes, I did. I think I did.
Okay.
Yes.
I can still break it down in my own words. If
okay, let me hear your words, sir.
Okay. Now, what the person is saying is he's seen a family where a member of that family is abusing a particular substance, and his brother, in order to give him some level of comfort or encouragement, not to, give the impression that he's not being stigmatized, started taking the same substance. Now he's now asking, how far can a family member or a friend go in order to prove their love or their care, as this family had done, going to the extent of even taking, I don't know how we can reconcile that, going to the extent of even taking the same substance in order to give to make the person feel comfortable.
Well, that's actually a very, I would say it's a very wrong move to start with, because so you already have somebody in the family battling with addiction. You now say you're giving the person comfort by going to use. I won't say that is a good comfort, because like I said, when I had my presentation, I said when one person is suffering from either mental illness or substance use disorder, it affects the whole family. So for that person, what that person has done is not the right way to give comfort for the patient. That's no way of comforting the patient against stigmatization. Rather, encouraging the person to get help, encouraging the person to go to rehab, for treatment, is a better way of comforting the person, helping the person with going for therapy session, saying words of affirmation. These are comforts you can give to someone that is battling with either mental illness or substance use, not you now indulging in that same thing. And when I started, I said something like, some of these illnesses, some of these disorders are actually genetic. So it might actually be a genetical thing in the family. Either they're prone to be addicted to substances because it's genetical. So for that family, they need to stay off. Everybody in that family needs to stay off substance, because there is this likelihood that they're genetically predisposed to being addicted to substances. Thank you.
All right, thank you, Dr. Ben. Dr. Uzo, you were trying to were you trying to say something? Or we should go ahead? Okay.
Yeah. Thanks, Baba. We're just trying to add to what Mrs. Oluwatoyin has said. some of the situations might be familial, genetic, but there is one concept in mental health and psychiatry that refers to sympathetic association to a disorder. So it's an unconscious way trying to respond, thinking you're being helpful and identifying with the person, but what you end up doing is enabling the behavior or making the illness worse. Sometimes it happens unconsciously, even the person doesn't know he or she is doing it. A typical example, believe it or not, it even happens in pregnancy, where a man starts thinking that he is having pregnancy symptoms because the wife is pregnant, if that makes any sense. Yeah, but it's a phenomenon and it's known. But that's not the right way, like Mrs. Oluwatoyin was explaining there. Don't become the enabler. Sometimes it could be due to the genetic, the familial nature of the illness. But as far as helping the individual goes, no, that will not work. You end up having two instead of one.
All right. Thank you very much there for the additional information there. Okay, let's get this one from Enning. Okay, now I will have to ask the three questions from Enning. Our question or his or her question is always loaded every week. So, Ms. Oluwato, you need to take note of this. Let me take her three questions. A straight line can be drawn from family lines, history and growth situations to the future mental health and drug addiction patterns of a person. How can families redeem themselves even as they seek to help the person who has the mental health problems? Let me read that again. A straight line can be drawn from family lines, history, and growth situations to the future mental health and drug addiction patterns of a person. Now, how can families redeem themselves even as they seek to help the person who has the mental health problem? Please note that, Ms. Oluwatoyin. Let me read the second question. What are some warning signs for families to look out for in young children who are not yet exhibiting behavioral changes that there is susceptibility to use drugs in the future? I repeat, I come again. What are some signs, warning signs, for families to look out for in young children who are not yet exhibiting behavioral changes, but but that there is susceptibility to use drugs in the future? And the last question from Inang is: mental health and drug addiction affects a family. Are there checklists and factors for families to evaluate themselves, even as their children or family members undergo treatment? I'll repeat that again. Mental health and drug addiction affects a family. Are there checklists and factors for families to evaluate themselves, even as their children or family members undergo treatment? Okay, let's get your response to this loaded three questions, Ms. Oluwatoyin. We can't hear her again. I guess she's struggling with her network again. Dr. Uzo, would you want to step in for us again?
Can you hear me? I was hearing you.
Okay, now we can. Okay, we can hear you now. Very good.
Okay then. So I said I was going to start with the second question, where he asked if there are warning signs that parents need to watch out for in case a child might end up using substance later in future. And one of the things we do in the family life setting is that when you have children, there are so many things you need to teach your children that can actually prevent them from going into substance use. So I'm focusing on substance use now. And one of the things we need to do as parents or as family, head of families, is that we need to have values. We need to teach our children certain values and certain life skills. That these life skills, once our children have been able to imbibe and internalize these life skills, it becomes very difficult for them to become successful to drug use, because they are people, they know themselves, they know their strengths, they know what and who, they know what they stand for as a family. So it's important we teach our children problem solving skills. It's important we teach our children how to um, cope with stress, how to deal with stress, emotional intelligence. Because most times when we have these sessions for patients, most times their triggers are internal triggers. And because the triggers are internal, that's emotional triggers, we need to teach our children how to handle their emotions and how to handle things happening around them. Very, very important, because these are things we can do to help our children not to become addict, or not to become the history, family link, and all that. For me, I would say that one thing parents need to look out for here is the environment. What environment, or how is this child, or what are the things happening in your family that can lead to mental illness? So like I said, for some family is they're genetically predisposed, but certain factors might trigger mental illness or substance use in some families. Look out for. Hello.
Yeah, go ahead. Even though you went off, but you are back. Can, can you hear us? Oh, okay. We lost her. We lost her there. Okay. We may have to plead with Dr. Uzo to please step in for us now. I don't know whether the glitch is coming from X or from their individual network. Dr. Uzo, please, if you have, okay. Thank you. I think those are good questions that I think people need to benefit from. Please go ahead. Thank you.
I can come in briefly while we wait for her to come back in. The first question, I think he or she was talking about future mental health problem in the family or something along that line. If you recall, last week I talked something along the lines of adverse childhood events. So these are, a lot of them are environmental factors that can predispose people and to a lot of illnesses, including substance misuse, some like parental substance misuse, parental mental illnesses, physical abuse in the family, emotional abuse in the family, parental incarceration. When all these risks are added together, it increases the risk of a child or an individual developing mental health, substance use disorder, depression, even diabetes, believe it or not, high blood pressure, things like that. So it seems like our path in life is built in our home. Once we were born, we start to develop risk factors. Now, how do we start? This would now take us to the third questions, third and second questions, where she was asking what are the warning signs? The warning signs, for example, for a child, if you have a child, say, especially in secondary school, because that's when you lose the sight of them a lot, you'll be looking for things like changes in behavior. You'll be looking for simple things as what are the kind of friends they keep. One of the trainings I do for GP trainees here is to tell them how to identify drug use disorder. And one of the things we stress is, why does somebody start using drugs? I'm going to use myself as an example. I smoked. I don't smoke now, but I smoked years ago. When did I start smoking? Thinking when I was reflecting on this, my training, I started smoking In the university, in my first year, because my friends were smoking, I never smoked. So using that as an example, I don't smoke now. I've smoked for millions of years. I don't smoke, but I'm using that example to impact. So the things you have to be watching out for are: one, any changes in behavior should be a warning sign. What are the friends they keep? Do you know their friends? Do you have a relationship with your child? By that, I mean, is your child open to talk to you? Do you people talk? These are the things we do not do. It's very simple, but it does help. Sometimes the child might come back and say, oh, my friend was smoking cigarettes or my friend was smoking cannabis. So many kids as a teenager do smoke cannabis, but not many of them will end up having dependency. So little things, developing a relationship, knowing what's going on in their lives, allowing them to speak to you will enable you to know when there's a behavior change. When they start taking to their rooms, they don't speak to you anymore. That's a change. When they start locking their rooms, they've not been locking their rooms. You go, what's going on? I don't know if that makes sense, but so those are some of the ways to watch out for changes and possible drug use in the family. On the checklist, what are you looking for? A checklist. Let me just mention this. I was going to say it, but I forgot. One of the biggest causes of drug problem, especially opiates back in Nigeria, is pain. A lot of us are prescribed pain relief. A lot of the pain relief they get are opioid based, and we take them longer than we should, if that makes sense. It's called iatrogenic causes of dependency, but it's very, very common. So if you're being prescribed medication for pain, ask your doctor, what are they and how long should you take them for? Are they dependence causing medication? Do you need to change to something else if you have to use pain relief for a long time? So those are the checklists you look at. If your one is in rehab or undergoing treatment, generally, Mrs. Oluwatoyin was speaking, there, things like family therapy as well, they do help. We call it structural psychosocial support. So awareness, education, understanding, they do help with treatment, they do help with stigma, they do help with bias and prejudice. I think I'll stop here to give other people a chance to speak, Brother Femi, if that's okay.
Thank you very much there, Dr. Uzo, joining us live from the UK. Thank you for always being available, especially in situations like this. Okay, Ms. Oluwatoyin, I hope you are back now. You can hear us now.
Yes, I'm back. I can hear you very well.
Okay, thank you very much. Would have to say a very big thank you to Dr. Huzo, who is always stepping in anytime the network takes you offline like this. Okay, let's quickly take the next set of interventions from the Niger Diaries, then followed by college reporters, and then we'll come to Uncle Mo. Okay, the Niger Diaries, please go ahead. Let's get your question or your intervention quickly, please.
Thank you. Good evening, everyone. Kudos to the guest speaker. My question is, I just want the guest speaker to um, talk more or shed more light on what we call this, the first stage that you try to encourage victims. You are victims of substance abuse to go into rehab. There's what this Dr. Abdullah called it last week. I think something interview. So I wanted the guest speaker to shed more light on the first stage. Then secondly, I'm very concerned about rehabilitation at the community level. I mean, I live in the northern part of the country, so when I mean at the community level, it's difficult for them to actually access treatment. So how do we kind of make them serious, educate them to actually consider going into treatment? Thank you very much. Thank you, Mr. Wafemi. Thank you.
about. Hello, can you hear me?
Yes, I can hear you.
Okay, thank you. So I had the second part about community-based rehabilitation. I think you should be able to empower certain public health facilities that could do this community-based rehabilitation center, because honestly, rehabilitation in some parts of the country is actually high and expensive. But if you can make it affordable, if you can do, maybe you could have one or two public health centers that can be rehabilitation centers in communities, maybe two or three in every community. I think it would be very good for NDLE and to help out with this, and also help out in eradicating substance use and its abuse. The first part of the question, I didn't get that.
Okay, let's ask him to come. I think what he was actually asking about some initial processes of getting somebody off substance abuse, like the first heart-to-heart. Our last guest speaker, Dr. Abdullahi, I think
Okay.
Dr. Uzo was also part of that conversation, and he did talk about heart-to-heart conversation with the person. That is a period of getting the person, building confidence and what have you, so that the person can open up. I think that's where he's asking for more explanation. Yeah.
Okay. So I think I listened to the last speaker, and he mentioned something about motivational interviewing, where we get the. So this is just the process pay to come in for the recovery, because it's not all patients that would want to come in voluntarily. And one of the things we're advocating is that we're advocating for voluntary admission, voluntary rehabilitation. So one of the ways we can get people to come in voluntarily is when we use motivational enhancement therapy or motivational interviewing, where we speak with the person and we get the person to be committed to coming in for therapy. That's very important, because most times, like I said when I started out, when we get people in involuntarily, it's difficult for them to sustain the recovery process. But when they come in voluntarily, when we're able to convince them and encourage them to come in by themselves, and for them to be motivated to come in for the therapy, the treatment is sustained and the treatment is successful. So I think that's what that question was asking about.
Okay, the Niger Diaries, you still want to say something to that?
Yes, I just wanted Ms. Ulla to actually shed more light on them. Yes, okay, trying to check them in and trying to access the treatment. I wanted her to actually, what are those things, okay, who do we employ in trying to get them to check in into treatment? Who do we work together with, or who do we partner with in the community, at the community level, to get them, the victims, to check into treatment?
Okay, thank you so much. So at the community level, I think it starts with the family. Like we say, the family is the smallest unit of every community and every society. So it starts with the family. The family, you should be able to work with the family members that they respect, either the parents or uncles or aunties, family members that would not stigmatize them. These are people you need to work with to get them to come in for treatment. Now, if we don't have family members that they respect, or family members that would sympathize them, then we should look for other people in the community, either a community leader or a community health professional that can do this motivation interview, motivation and enhancement, to get them to come in. Because it's very important that we get the buy-in of the patient. The moment you get the buy-in of the patient, treatment, therapy, and recovery will become better, because the patient is internally motivated to go in for treatment and recovery. But when the patient is not internally motivated, it tends to be kind of difficult. So we work with the family members, siblings, or any other health professional around in that community that that will not stigmatize. I think these are people that we can work with at the community level.
All right, thank you very much there, Ms. Oluwatoyin. Dr. Uzo, you want to say something to that?
Yeah, thanks again, Dr. Babafemi. Just and thank you, Mrs. Oluwatoyin. Excellent response there again. I just wanted to add to what Najadar is asked. He was asking about the Dr. Abdullahi's presentation the other day. So from my understanding of what part of the question was, Dr. Abdullahi talked about recovery cycle. There's this thing we call recovery cycle. And that cycle consists of pre-contemplation, contemplation, preparation, action, maintenance, and setbacks, which will be lapses in it. So the pre-contemplation, which is what I'm understanding, is where he's having the difficulty to get people to come in. Again, this is a phase, and that's normal. But one of the things that the drawbacks there is that the stigma, they don't want to talk to anybody about it. They're not ready to do anything, and there is nothing you can do to make them change at that stage. That's the pre-contemplation. They're not even thinking about it. And the next stage following that will be the contemplation, where they're thinking, oh, probably this is a problem. This is costing me my life. This is costing a lot of resources from my family. I may need to address it. And this is the stage where, if you're lucky enough to catch them, coming back to what Mrs. Oluwatoyin said, this is where the family, the friends, here what we do is that we have a flyer that goes along the lines of, if you're worried about your friend, come and talk to us. So somebody else can make that referral, and then you can see if you can engage them to bring the person to have that initial conversation. And this is where you begin to do your motivational. Motivational interviewing can be more than on one occasion, can be successive occasions where you talk about what's going on. And then what you're trying to do there is to get them to that stage where they go, I think I am ready. Because you need for them to get to that point where they feel they need that support, even though it's there. If you force them, generally they fail most of the times, unless they voluntarily, like Mrs. Oluwatoyin said, unless they voluntarily want to do it and voluntarily want to engage. So if you're struggling to get people in, like you said, in the North, that's understandable. You need a lot of education. You need a lot of awareness training, even if it means distributing flyers, even if it means talking about it. We go out in schools here. So you can do that. There's no reason why I shouldn't be able to do that. All right. I hope that helps.
Absolutely. Thank you very much, Dr. Uzo. Okay, let's take, please, Ibrahim, you keep straining in. Please remain muted. I don't know whether you are not in control of your phone or your tablet there. You keep straining in to interrupt. Okay, let's quickly get hear from Uncle Mo. Then we come to college reporters. Uncle Mo, please unmute yourself. Let's get your contribution or question quickly.
Okay, good evening, everyone. And I want to thank
I think Uncle Mo, we lost you.
Program.
Okay, great.
I think we as parents too, we have a whole lot to do, because today what you find in the society is we parents hardly bond with our children. We've contracted we've contracted parenting out to other people, all in the quest of looking for money, wife working, husband working. And at the end of the day, that bond that is supposed to exist between children and their parents is not there. And so the child grows up getting to respect their peers more than the parents. And like someone mentioned, once you get to the age of 15, 16, those are the most difficult age. And for parents, that is when you are supposed to be
most close to your child. But what we see these days is parenting. As parents, some of us have failed. I must say this. Though some people may not agree with me, but for some of us, we have failed in terms of parenting, and because there should be a relationship between you and your child. Though sometimes when the child, like I have a problem, which I mentioned in the last program that we're trying to manage, and once in a while we try to withdraw the child close, because as much as we can, we give the child the best of training before going into the university. It was when the child, my son, gets to 100 level, a law student, that he now went and met bad people. And before we know it, he was co-opted into the habit of smoking weeds and all manner of substances. And the cost is enormous, I must say. Mentally, for the parents, cost of rehabilitation, the child, what you lose in terms of um, not him being able to continue with education because of he can't even cope, and all other mental stress that one is faced with. So I want to advise that we keep up this good work, and parents too should, as much as we can, get to bond more with our children, such that before they stray, we'll be able to catch them and bring them back on track. That's my contribution. Thank you.
Thank you very much there, Uncle Mo. Very inspiring one there. Thank you. And we do pray that definitely you will overcome and get through your own challenge by the grace of God. Okay, let's quickly, because of time, we have barely 20 minutes more on the program. Let's come to college reporters. College reporters, please quickly, let's hear your question, your intervention quickly before we go back to our DM to read some questions.
Thank you, Femi. It's so good to be on the platform today. This is Philip Omale speaking from College Reporters. Thank you, Dr. Uzo, and thank you, Oluwatoyin, for the awesome contribution. It's always a great opportunity tuning into the platform for the weekly digest. You see, the contribution I want to make and emphasize on is that the family is the primary leaders or the supporter for one who is facing stigma. The family is primary. After the family, friends and other colleagues and others can assist. But when the family loses it in the place of providing support, assistance to aid one who has a stigma, then you can see that a whole lot will go the wrong way. And at College Reporters, one thing we always do is that beyond just education and study, we always give college advice to students on campus and how they can be better. Let's take a case scenario where you have in a campus, students are far away from families and parents, especially those in the tertiary institutions, only at the high schools. You see that one thing we always advise students and youth out there is that who are your friends? When family are away, you need the best of friends to help you. And that is why Dr. Uzo said something which really, really, really is the truth. And he said that it comes to a point of self-stigma, where the patient is not willing to say anything unless they are caught in the act. They are already having a self-stigma of the mental challenge. They don't want to speak out. They are keeping it back. Unless you as a family member, unless I as a friend come to realize or come to find out, come to know that, oh, this is what this person is. And by the time you get out of that self-stigma, that is when you can see that they want to seek for help. So what do we say, or what is our take in this, our contribution in this, in all? We always advise, be it a student, be it a youth, wherever you find yourself in a college environment, the best thing to do is to hold up to friends in school that can always turn up for you. You see, most of the thing is that when these things happen or when it goes the other way, students get abandoned. They don't want to tag with such person. Why? They only prefer to cast according to student slangs. They say, maybe my matter they go talk. Because you see that students will want to talk about the person and they'll cast the student. And you see, they are not helping out. So if I don't, as a student, if I don't get the best of friends who can help me while my parents are away, while my families are away, you see that it becomes more challenging. So if you're a student out there in the tertiary, in the colleges, the best of things you can surround yourself is good friends who can help you. Because it is those friends that will take you first, either to the school clinic, school hospitals, wherever you need attention, then further before parents or family members can come in from the far distance or wherever they are. So you see, stigma can be so much that if it's not properly handled, you see that only the family will be casting away the patient. Friends will be casting away the patient, and it becomes a larger problem. Rather than solving the problem, we are increasing, expanding, escalating the problem. But it gets me confused. It gets me confused, which I have a challenge in this topic. How can families, parents, friends avoid escalating stigmatizations? A patient who is having this issue, rather than help him. How can? Because you see, if you don't apply the right approach, as family members, as friends, we are not therapists to give them the best rehabilitation ethics. So how can we avoid, in a bit of correction, a bit of showing love, someone shared that, okay, a brother was trying to help a brother by rather taking the substances. And that's the wrong approach. So the challenging aspect is that how can we, because we need to know much better as friends, as family members, as parents, how we can only aid before we only get the right therapist or other health experts to help us in this challenge of stigma. So
thank you.
I don't know if Mrs. Oluwatoyin can enlighten us a little bit on what measures, practical measures we can take as parents, as friends, in a short distance to help us, rather than escalating, rather than expatiating the whole stigmatization, we can help the patient. Thank you.
All right, thank you very much there, Philip O'Malley of College Reporters, for your intervention. Ms. Oluwatoyin, did you hear him?
Yes, I did. I heard
very good. We appreciate your network this time around.
Thank you
Please
so
go
much.
ahead.
Thank you so much, Mr. Philip, for that question and all the points you raised. First thing, as parents, as family members, as siblings, as friends, is that we need to educate ourselves. So you have a family member that is battling with either mental illness or battling with substance use disorder. Instead of us castigating a person, I think we need to do more of psychoeducation, getting to learn more about what is wrong with this person. And another thing we need to do is we need to start talking openly about it in the home. Most times in the home, because we are ashamed of what the person has done, we tend to talk hush hush, we make it secret. Maybe the younger sibling doesn't know that the older sibling is in a rehab center and all that. But I think we need to start talking, having this open form of communication in the home, whereby family members get to understand the negative effects of substance, and also family members get to understand what are the signs of maybe someone that is using or someone that has mental illness. So like the other example that lady gave, that the lady that's it. So you should teach yourself, have open communication, avoid blaming the person. We should watch the words we use. So one of the words we don't use is calling the person addict, labeling. Instead, we say the person is battling with substance use disorder. The words we use, educating ourselves, and also having open communication in the home help the person will help the person to actually go in for treatment and therapy. Thank.
All right, thank you very much there, Ms. Luatoyin. Your network is struggling with us today, but then we thank God that God is stronger than that network, and we're almost there at that point. 2 hours gone. Okay, let me quickly read some messages from DM. These are not questions per se, but they are just messages from Dr. Koloje. Thank you, Dr. Oluwatoyin, for your beautiful presentation. Many thanks also to the contributors for their diverse and excellent opinions on the subject. I want to humbly suggest that we take the messages presented here today beyond this space. We may consider sharing these messages with our counseling, treatment, and rehabilitation centers across Nigeria, where parents, relations, and friends of recovering drug users can get to be educated. Um, then there is another. Okay, that this one is from Mr. Jeff. Um, that's a very excellent example. Thank you for your efforts. Okay, that's for Ibrahim Yusuf. Please, Uzolo. Okay. Who else? Okay. Okay. I think the Niger Diaries already has. Okay, I've seen your message. The Niger Diaries. I'll definitely read. Okay, then there is okay. That's AGN at AGM for real. That's Abdul Ghani. I remember the full name now. That is drawing the attention of Dr. Abdullah at SL Mental Health. That there is a message for him. His DM since last week. He's yet to respond to it. Okay, we'll help you, Abdul Ghani, to draw the attention of Dr. Abdullah to your message in his box. Okay, I think oh, it's 2 hours already. Okay, before I get Ms. Oluwatoyin to give us a parting shot on this conversation today, let me quickly get Dr. Uzo to give us his parting shot on this conversation today, and then we'll come to Dr. Ms. Oluwatoyin. Please go ahead, Dr. Uzo.
All right, thanks, Baba Femi, and thanks everyone for giving me the opportunity today to talk. I mean, when we're talking about stigma, ask yourself if you see someone with mental health problem or if you see someone with substance use disorder, are you blaming them? Are you being judgmental? Are you being biased? Are you stereotyping them? Are you discriminating against them? Are you outcasting them? Are you shaming them? So these are simple words, but when you think back, you realize that's essentially what stigma is. That's the problem you're dumping on them. And for us, to start and begin to get around the difficulty, we have to start with being open with ourselves. As a family, we have to start being open. And like Uncle Mo said that we need to start bonding with our children. We need to start knowing who they are. We need to start knowing who their friends are. We need to start understanding when the behaviors begin to change, something is wrong somewhere. Anyway, let me leave it at that, and thank you all for giving me the opportunity today again. Cheers.
Thank you very much, Dr. Uzo. Dr. Uzo is joining us live from the UK, and we appreciate your being around every week. Your contribution has been so immeasurable. Thank you once again. Okay, now we get the last shot from our guest speaker today, Mrs. Oluwatoyin Ogunkami. Please go ahead.
Okay, thank you so much, everyone. I really want to apologize about my network, but one thing I want to discuss, or the final thing I'm going to say, is that as parents, our primary responsibilities is to raise our children right. Our primary responsibility is to be their emotional support. We should not live in denial. There are certain things we should have done that we've not done. It's important as parents that we retrace our steps. We need to be emotionally connected with our children. We need to teach our children the right values and give them, equip them with tools that would help them to withstand negative influence, and also tools that would help them to withstand stress. There are a lot of students who are going through stress right now, and their parents are not even aware. And the next thing they will hear is that the child is using substance, and they were like, "How? Where did I get it wrong? What happened to you?" Unknowingly to the parents, the child is going through, and parents, that we know our children. We have a good relationship with them. We equip them with skills and tools for them to thrive, to become better citizens of the country.
Okay, I think I think we lost Miss Oluwato in there again. Okay, at this point, we'd like to appreciate
Mental
that.
health, thank you,
Okay.
Mr. Faye. Thank you, everyone at NDLA, for inviting me over. And I'm signing out from here. Thank you so much.
All right, thank you very much. I was almost happy you to sign out where we lost you again. I think next time when we're bringing you on this program, we'll have to probably relocate you to a place where the network will be better. All right, that's that. Thank you very much once again. Our guest speaker for today, that's Mrs. Oluwatoyin Ogunkami, a psychologist and convener Smart Parenting Community Outreach. Thank you for being part of this conversation today. We want to thank everyone that has been part of this program today, especially Dr. Uzo. Thank you very much again, Dr. Uzo. Let's appreciate again all those that have made contributions, especially the Niger Diaries, Perpetua Namdi Emmanuel, Aminu, Ibrahim Yusuf of Drug Free Arewa Movement. Thank you, Pastor Jeff Oluwagbemiga. I think I read your message in the DM. Thank you, our commander there, Parabawa, Dr. Jonah Kolo, who made also some recommendations in the DM. Thank you, Kumbo, for bringing personal experience to bear on the conversation today. We also want to appreciate Philip O'Malley of College Reporters also for your intervention. Thank you again. I have seen another person. I'm sure she'll be shocked that, but I won't call her real name. I'll call her by the name of her handle. Auntie Kemi, thank you very much. I've seen you. I won't call your real name so that you won't come and harass me later. Thank you very much, everyone that has been part of this conversation today. I want to thank my colleagues that have been very supportive at this end, those working behind the scene. Thank you, Shidi. Thank you, Musa. Thank you, Francis, Mahmoud, Dele, Phil, Lex, Kumbi, Unko, Charity, John, Blessing, Ima, Ali, and all the rest of you. I appreciate you guys for being there. God bless you all. Now, my advice to you all, this is Friday, the beginning of the weekend. Please, let's not go out of line. Let's do everything we have to do in moderation. That's very key and important. Again, as parents, let's keep our eyes open, our ears to the ground. Let's, our speakers have said today, let's bond with our kids, our children, and even those that live with us, so that we can have heart-to-heart conversations with them from time to time. That way, we will be able to know what's going on in their lives, and we will be able to take the right interventions as early as possible. And that's all for this conversation today. Once again, we'd like to thank everyone that has been part of this. Next week, this time again, we would be coming with another exciting topic. I can tell you that we'll have another expert in this great field next week by the grace of God, who will be sharing with us deep insight, deep knowledge about substance abuse and some of the consequences, some of the things that accompany and that come with this, and how we can overcome all of this. Until then, I remain yours sincerely, Femi Baba Femi. And at this point, I'd like to invite Mahmoud to properly and formally close the space. Thank you. Bye-bye.
Thank you very much, sir. And as you rightly said, this brings us to the end of the program. For more information about the agency, our listeners can visit our social media handles at MDLA_Nigeria on Twitter, Instagram, and YouTube. And on Facebook, it is at MDLA.
Gutter water handle you, you go just die throw away. Money handle you, you go just die throw away. Ecstasy handle you, you go just die throw away. Money handle you, you go just die throw away. Drama handle you, you go just die throw away. Money handle you, you go just die throw away. When cocaine handle you, and codeine handle you, handle money handle you, you go just die throw away. When black mamba handle you, and ref not show you shade it. When he handle you, you go just die throw away. Oh no, mama, no wait until them handle you. When they handle you, you go just die throw away. Paradise, oh, Vista Metro. When them handle you, you go just die through.